What is uveitis eye disease? Uveitis is an inflammatory condition that affects the uvea, the middle layer of the eye. The uvea consists of the iris, the ciliary body, and the choroid. The pain associated with uveitis is often described as a deep, aching pain within the eye. It can vary in intensity and may be exacerbated by eye movement. The indirect ophthalmoscope is used to examine the posterior segment of the eye, including the retina, vitreous, and optic nerve head. Eye drops contain corticosteroid medications, such as Prednisolone or dexamethasone, which help to reduce inflammation within the eye. Applying a cool compress over your closed eyes for 10 to 15 minutes several times a day can help reduce inflammation and soothe discomfort. Ensure the compress is clean and gently press it against your eyelids without applying excessive pressure.